Almost half of children who go to the emergency room with a mental health crisis don't get the follow-up care they need. That's according to a study conducted by Children's Hospital of Chicago. Researchers found less than a third of children have an outpatient mental health visit within 7 days of being discharged from the ER. A little more than 55% had a follow-up within 30 days, so nearly half did not. Here in Florida, the response is actually even worse. Only about 22% of kids get a follow-up visit in 7 days. 37% get one in 30 days. Now, those numbers are based on data from 2019, by the way. Separate studies show the rate of mental health issues soared during the pandemic. Psychiatrist Dr. Yalda Safai joins us now this morning via Zoom. Good morning. Thanks for being with us.
Good morning. Thanks for having me.
Would you explain, doctor, what factors play into this lack of follow-up care?
Of course, it's actually very simple. There is just not enough mental health individuals, mental health professionals to meet the growing demand. Up until now, the field of mental health and healthcare overall has been extremely neglected. And at this point, we're paying the price for neglecting mental health all those years. At this point, we have an increased demand after the pandemic. Mental health issues have soared, especially in children and adolescents. And now we're needing mental health professionals to treat patients in the field, and we simply just don't have enough mental health professionals to meet the growing demand.
Given that, is there something that makes the mental health profession just not attractive to people? Why do you suppose there just aren't enough? Is it just hard catching up?
No, this is complex. It's been mostly stigma up until this point that has led to basically the government, healthcare, to not allocate adequate resources to the field of mental health. Now people are more open about needing mental health services. They're more outspoken about it. And we've seen an increase in demand after the pandemic. So all of a sudden now the government, the healthcare field is waking up and saying, oh my gosh, all those years that we failed to allocate resources and funds to this problem is now going to catch up with us.
And are there certain groups that are really at need for mental health when it comes to young people as well? Men, women, girls, boys, certain ethnic groups?
Of course. So as a field overall, we don't have enough mental health professionals. But in the field of child and adolescents, we have very few child and adolescent psychiatrists out there. There's some counties that have none in their vicinity. So I think that population, child and adolescents, is more at risk here.
And what is it about the pandemic, do you think, made this gigantic jump in this need?
You know, it's a complex issue, but the biggest culprit is obviously isolation. Being outside of school, being outside of a social environment is damaging. We're social creatures. We need human interaction. So people who could have the potential for mental health problems or who had mental health problems, they just saw it exacerbated. Now, they didn't have the school system to go to. There's school counselors, there's school nurses that they go to, albeit they're underfunded too. But they did have that before the pandemic. And during the pandemic, for a period of 2 years, it was taken away from them.
So it's interesting because, you know, parents who are watching who may be concerned, for example, about their children and their child's mental health may not even know where to begin. You know, is this something that is covered by insurance, as an example? And what recommendations do you have for a parent who has these concerns?
Yes, of course, they are not alone. Navigating the field of outpatient mental health can be very challenging and confusing. Yes, they are covered by insurance, but unfortunately, wait times can go up to 6 months, especially to see a specialist like a child and adolescent psychiatrist. You're looking at a 6-month wait here. If you want to pay cash out of pocket, obviously, you can see a professional sooner, but the wait times are high, and usually these needs are immediate. So right now, what they're doing is they're using the emergency rooms as a first resort when it really should be a last resort. I think it is up to the emergency rooms to place in appropriate aftercare for the patients. Giving them a number and sending them off and telling them to book their own appointment is not enough. There needs to be social workers in the emergency room who can make the patients their appointments and triage based on severity.
Well, it's certainly eye-opening because you hope that you never need these resources. And if you do, it sounds like there are just not enough people who are available to offer it. Dr. Safai, thank you for your time this morning. We appreciate it.
Thank you for having me.